What's up today, guys? Got a little different video. Today we're going to give an honest review of a product I just got in the mail. It's from Vortran Medical. But without further ado, let's cut to the intro. All right, let's get this box opened. Probably should get a knife on this. I don't think I can manhandle that one. This is better. This letter from Vortran Medical. We have the Vortran Percussive Neb 2.0 with their brochure and a Go2Vent 2. Sweet. Wow, this is an upgraded version of the previous vent that I used. Look in the description at the top. That's where my old Vortran video is, using the other version of this. And this must be the Percussive Neb. Alright. Alright. And then this is the Go2Vent. Looks like that old Vortran ventilator. At least that I had a while back. Probably in a video where I was much skinnier too. Alright. Open it. Let's see. Parts here. We got some kind of bifurcated circuit. Nebulizer and a stand. Okay. Instructions. I'm a respiratory therapist. What do you need instructions for? I'm joking. I probably need to read these. Okay, so let's see what we have here as far as instructions go. So let me show you this device a little closer up. Okay, so you can see on the top there we have our mouthpiece here. Nebulizer on this side. On this side, it looks like it's an adjustment. It says, let me see how close I can get here. One side says softer, and one side says harder. So that's which tells you which direction to turn for that. So that's going to be your pressure and percussion that you're going to change with that. So we'll change that up a little bit. You see on the side, this is interesting. I kind of like this, and the fact that it comes with its own Christmas tree or nipple nut adapter. That is really nice because there was some recalls on these a year or so back where these were only labeled as single patient use, and that was kind of a real pain because we commonly would leave these in the room. Something that never actually touches the patient, and it's kind of a technicality, but it's nice that this device comes with these already and they're clear. I'm sure that's nice when that connects on here too, because one thing that I did find that which might make this a little bit difficult to use clinically is the fact that you need a flow meter that's going to run up to 70 liters per minute. Now standard flow meter, we'll look at that in a second. Standard flow meter at flush is about 40. So I'm going to use that today for this. And what it says in there is, it says in the instructions, it says that optimal flows are 40 plus or minus 20%, 25%. So we need to go up or down with that. So I can see that as one limitation right off the bat, because if you're going to use these in the patient care areas, having that We call it an anesthesia flow meter, but having that flow meter that goes up to 70 or even higher might be a little difficult, and then also super confusing when it comes to other clinicians and nurses and everybody else. And they see a flow meter that goes up to the top, and you know, if you don't look at the numbers, you could really blast somebody with dry oxygen. So that's just one thought initially on it. Actually, I did this wrong. Let's see. All right, so this piece here is going to go on that. So the bifurcated end, and then this looks like it nicely fits on the nebulizer, which is really cool. So we're going to percuss and nebulize at the same time, so 2 for 1. Hey, like to save the RT's time whenever you can, right? And this looks like this is going to be the stand it's going to sit on, so then you could leave it. However, it's kind of a bulky thing, so that it wouldn't be laying on its side or wherever patients put things. You know, you've seen them all over the place. So this is kind of a nice option to have, so that it can sit on something and not be laying on its side and mouthpiece all up in the goodness. So let's get over, and I'll hook this up to a flow meter. I only have a 40 lead per minute, but we're going to run it on that just to see what it does. And then I'll give you an idea what it feels like. Put some saline in this little neb here too. This is a big fatty bullet, 15 ml bullet. Put some extra in there just in case. All right. Cool. Let's run over and so I'm over here at the flow meter. We're gonna run this thing and kind of see what it feels like. Take the Christmas tree off of this one. So standard flow meter, you've seen these before. Of course, they go up to 15 liters per minute, and then usually somewhere on the flow meter, which this one doesn't say, but usually when the ball is at the very top, turned all the way up, it's 40 liters per minute. So that's going to give us an idea how much flow we need. So we're going to run it with the standard flow meter. It really seems like what we're going to do is we're going to turn it up to that amount, and we're going to adjust for comfort. So let's do that. Running those high liter flows, it's nice to have one of these pre-attached because it's going to attach really tight. So. Okay. So you can see what we have going on here. Nebulizing here. Let's make it says start softer, so we're going to rotate it out a little bit. Alright. I'll take this little thing off the bottom. Alright, let's see what she does. Probably going to really need a long, prolonged expiratory cycle. That's usually what helps to break up a lot of mucus, and that's really what I believe this is going to be for. This is going to be for varying that pressure inside your airways to help you break up mucus. Now it's not going to actually, you have to have a cough to get it out, so it's going to help to get that mucus into your larger airways so that you can cough it up, and that's really the most important part of any kind of using mucolytics or using any kind of device that's going to help break up mucus or get it into the other airways. It's going to break it off the sides into the lumen so you can get it out. So you still have to have an effective cough for this stuff to work. Also, this pressure going in, I saw it's up to 4 centimeters of water pressure. That can actually recruit some alveoli also. So you get lots of mucus plugging and things like that. You get the mucus out, you can recruit alveoli back, help oxygenation. So let's give it a shot. Ooh, I didn't adjust it quite right. Softer. Ooh, there we go. It's like a little motor. That's it. I didn't have the flow turned up high enough. Now it's kicking in. So, going a little bit too high. This is really interesting. So what it feels like, sounds like a little small engine running, but what it really feels like is a lot of expiratory resistance, very similar to EasyPap. So EasyPap, we know, it can be used to not just treat or prevent atelectasis. EasyPap can actually reverse it. It's got a feel to that. It's kind of got an inspiratory flow going in, and then the vibratory aspect is really interesting. It vibrates inspiratory and expiratory, so that's something a little bit different about it. But you can really feel the resonance down deep. Now, I think that this would be something really good for a patient who is actively involved and wants to get the mucus out. More difficult for a patient who might be more decompensated, and we have them like this, you know, they can't really even get a good seal with their mouth. But if somebody really wants to recruit some alveoli, break up mucus, this would be a nice option. So let me mess with it a little bit more. You can tell I'm trying to keep my cheeks tight, but it's really hard. But you keep those cheeks really tight, it resonates that down deeper, so it's not just all up here going on in your mouth. So wow, a lot of reverberations down in there. I don't really have a mucus problem, so that's a blessing in itself. But you can feel a lot of movement of air down there, and the cool thing about it is it kind of feels like it's really sharp. So really like the waveforms are like really fast and really sharp, so that does sometimes really help to knock the mucus off your airways. Let me just mess with some stuff and like crank it up and see what. I'm going to go all the way to hard and see what this feels like, because you know that's what we do. Woo, boy, that is awesome. Whoa! So, all right. So I put it all the way to the hardest one, and it really hits you. That's actually, I like that a lot better than the softer, especially if you have a patient who's that can understand any directions you give them and are really actively wanting to get this stuff out. Man, it really pounds you. Alright, so I'll tell you what it kind of feels like a little bit. It feels like you take the vest. You've seen the vest therapy. You take the vest, stick it down inside of your trachea, and then turn it on. That's what it feels like. It really does rock your airways pretty hard. So, as far as this side, as far as delivering nebulized medication, I don't know. I don't know about that. I question a couple things. As far as if it's running 40 liters per minute, bifurcating here, going to here, is that nebulized in the right size? Is that really for medication? I don't know. It likely could just be to give moisture, because this is a lot of dry air, and so we know that the air coming out here is 0% humidity, so that's a lot of dry air coming out. So this does moisturize a little bit. So I think that this is actually more for just saline. This is just an initial thought for it, but. Man, I'm gonna go just a little bit harder and see what it does. That's awesome. So, really cool device with a handy dandy holder there. But that does cause a lot of percussion going on in your airways, and if I was mucusy, we could at least see maybe it work a little bit. Obviously, everything, all these type of devices really need to be followed by some kind of directed cough technique, 1, 2, 3 cough, huff cough, whatever it is to help clear the airway. Because just knocking it out and recruiting alveoli is one thing, but you got to get the mucus out. Super, super important. So, and all your respiratory therapists and nurses know that, but it's just something we got to constantly tell our patients. Really cool to have devices, but they have to do a little bit of work on their own. I wonder if you can see this. Let me see how close I can get. Ooh, right there at the end of exhalation, it really pounds on it. So, obviously, I think that there would be some definite contraindications. Of course, if you have blebs, that would be one thing. That's quite a bit of pressure, just like Easy Pap. Look out for patients with blebs. I can almost feel that resonating up in my sinuses. So somebody who has epistaxis or something like that, maybe that just stopped bleeding, that would be something to think about too, because it probably could break that loose again. But powerful little sucker. All right, let's go look at the other thing. So we're back with the Go2Vent 2, or sorry, Go2Vent. I got that wrong. So let's get this thing opened and we'll take a look at this device. All right. Oh, I see some different things already. I really like when they put this stuff on here. It actually attaches to it. It's like, because we commonly open stuff up and things go flying. When you have this attached, it makes somebody actively look at the steps. And you can see the steps 1, 2, 3 on there. Kind of the basics, what you need to know. So it's nice because also inside of it comes this book, and nobody really wants to read the book in 12,000 different languages, if that's even. Let's see. Yeah, so nobody really reads that. What we want, something quick and easy. These things are really nice. All right, so let me see here. I'm sure that adapter goes there. All right, so this piece goes right here, as it seems. All right. Some different things that I do notice about it. We have a little bit of an adjustment here. 50 to 100. So in the previous one, it was either 50 or 100. It seems like 50 to 100. This might deliver a little bit of variable FiO2. Now, if you're going to use these, we're probably not super worried. We're going to want probably the most oxygen as you can on your patient, and you're not going to be worried about weaning and things like that, because this is really kind of an emergency vent. But the thing is that if you're able to change your FiO2 a little bit, you may be able to also entrain more room air and then use maybe a little bit less from the vent. But let me look at that. Not from the vent, sorry. 3, 2, 1. It looks like on here you can adjust this a little bit. You see how FiO2 50 and then up to 100. So let me look at this. Check pressurization. So with adjusting this flow here, the first thing I think about is maybe we can save a little bit on our tanks. So minute ventilation, 10 liters per minute, standard 1-to-1. FiO2 will operate for 30 minutes, plus or minus 10%, with an output or flow rate around 20, with a fully cylinder of 625 liters. That's about between 2,000 and 2,200
Now
PSI.
we're hooked up to the flow meter, as you can see. So this is our Go2Vent Vortran ventilator, but this is special because this has a manometer on it. You notice, you see the manometer is pretty sweet. Before, we really didn't know with the other model how much pressure was being delivered. So I really like this aspect of it, because it seems like when you put this on a test lung that it increases really fast and it gives a very large volume. But if you know from any kind of ventilatory type, if you've been in ventilation at all, you should know that monitoring pressure is extremely important. So having the pressure manometer is a great addition to this new Vortran ventilator. So let me turn some flow on, hook up my trusty test lung, and we'll go with it. So I'm starting with the 50%, as you can see on there. If I rotate that, it'll get a lot quiet. Actually, yeah, 50%. If I rotate it, you'll see it's a lot quieter. But what that does, obviously, if you understand the Venturi principle, it is going to decrease the amount of flow coming into the system. So I'm going to crank it up quite a bit to 50%. Just allows me to run a lower flow on my flow meter. Therefore, you'll be able to have a tank last actually longer than you could if you run on 100%. So let's go with 50. It's a little bit loud, but that's okay. So the initial setup, of course, this goes to the patient. And let's hook up my test lung to this. Okie dokie. So this, I haven't really adjusted anything yet. It's kind of going on its own, as you can see. It's triggering. We have a flow coming in. It's bringing in room air, increasing the pressure. And then I'll try to get a shot of this if I can see it. Let's see. Yeah, if I can get really close up on there. You can see how that cycles. As the pressure flow causes the pressure to increase, and then it's going to cause that to cycle. So first thing we do, number one, connect the gas source. Set inspiratory flow. We've got it done. Adjust as needed. Second thing, adjust the PIP with T dial right here. That's makes it pretty simple. Verify operation with manometer. We see the manometer, and then connect to the patient. So we can adjust our PIP here. It's like the tighter we go, the higher the pressure is going to be allowed to go. I like that 30 range. Let's just crank it up, see what it does to go all the way up. Oh yeah, don't like that. Looks like pneumos to me. So yeah, you don't want to go super high, obviously, unless there is a valid reason to do so. So I like that 20 to 30 range. You can adjust that in and out. A little too, let's see. Off a little bit. Well, kind of like that one there. Okay, so we have that adjusted in. Number 3, as you can read on here, adjust exhalation with rate dial, readjust flow, PIP, and blah, blah, blah as needed. So let's do our rate now. So we got this going again. Bump the camera. So let's adjust the rate dial up here. So let's count it right now. Let's see, rate 1, 2, 3, 4. It's a breath every 4 seconds. Let's slow it down. I really like a breath every 5 seconds. Gets you close to that 12 breaths per minute. So let's adjust this just a little bit. A little farther. Going the wrong way. Exhalation rate, plus or minus. Exhalation rate. So, I guess that would mean your respiratory rate. Respiratory rate to go slower. It's kind of a weird term, exhalation rate on there. So, let me readjust that a little bit. I'll go down a little bit, tighten it in a little bit. Now I'm loosening it up a little bit. Trigger. That's a little closer to what I'm looking for. So I cranked it kind of down and then brought it out slowly until it started to trigger. So Exhalation rate, maybe it's just me, but that's it's nice if it said respiratory rate, but I get why they say exhalation rate. I always think of exhalation time, inspiratory time, expiratory time, so that kind of messed with me a little bit, but go down just a little bit, see if we can slow it down just a little bit. When we get to a certain point there we go. Let's say, nice, slow trigger. There is going to be a little bit of intrinsic peep on this. The one thing that I really like about it is, watch, if I give this a breath, if I cycle it, patient breathes on its own. It's very similar to like SIMV in that case. So it will, actually not SIMV, kind of like assist control, because every breath is going to be assisted. So they don't trigger. It should assist. There we go. I didn't assist it. Just took a little bit of time. That's interesting. Right. A little breath. There we go. And if you're wanting more of a control rate, back that dude out just a little bit. Now we have more of a control rate. Great. I'll turn this FiO2 down a little bit. We'll turn it. We'll close our entrainment holes. So now we actually, it's much quieter, but it's 100% oxygen. So we got to compensate that by turning up the flow meter. So I know it looks like getting large volume with this, but remember it's really important to look at that pressure. So the pressure delivery is really important. So this is kind of a cool device. I really like, I love the improvement of adding a manometer. I think from a respiratory therapy side or respiratory therapist side, it gives me a little bit of, helps me to sleep at night knowing that I'm not increasing pressures, because if you close it off and you can't see that and you see how large that test lung gets, it really brings in a little bit of concern if you're giving too much pressure. But to have this and feel like you have an adjustment here, was really nice. So really nice change for this. And then also this piece here, this used to come on and off, the adapter for 50% or 100. So as you could change your entrainment or no entrainment for 100% right now. So really cool device from Vortran with this new one. Thanks for watching today, guys. Percussive Neb, pretty cool from Vortran. This is the one we did a little bit earlier. It has a lot of pressure coming in. The moisture in here is also nice because you're getting those really high flows coming from the wall. Man, I can really feel that as it's got kind of recruiting some alveoli. The one downfall I see to this is having that really high flow meter, that anesthesia meter, which, as I call them, but those flow meters that go up to 40 or maybe even to 60. So the availability of those are pretty low, but they're pretty easy to purchase too. I worry about them getting kind of mixed up in the swing of the hospital world. So that's one thing to kind of worry about with this. It doesn't give a lot of pressure though. And the Go2Vent, the Go2Vent, which the Vortran vent. This is pretty cool. The pressure manometer is super nice. I'm impressed with it. And I think this is much more user-friendly and more RT-friendly, I believe, than the other one that they put out. So thanks to Vortran Medical for sending me these so I could give an honest review of them. Great devices. Keep coming up with this. Respiratory therapy really is a very young type of medicine, really. I mean, it's been around for a while, but there's so many little things that we can do to improve. And I'll tell you what, respiratory therapists and engineers, they've got really cool minds. So there's going to be so many new things in the future that are going to come out, and I'm really impressed. I'm really excited to see them all, because it's going to be nice to see all the different devices that come out. And you know what the whole goal of this is that we provide excellent care to our lung patients. Actually, all of our patients, but you know, we're focusing really on those lung patients. You know, we see them come in exacerbation and hopefully get to see them leave and go home. So
We want the absolute best care, and we want the best equipment that we can use on them while they're in the hospital. And appreciate Vortran sending this stuff out. If there's anybody else that wants to send any kind of products out for me to run through them in our simulation center, please feel free to do so. My information's in the bottom. And like, subscribe, and I will see you later.